Hello everyone, my name is Dr. Mallikarjun Kalashetty. I'm the head of the Department of Clinical Haematology, Haemato-Oncology, Bone Marrow Transplantation and Cellular Therapy at Manipal Hospital, Old Airport Road, Bangalore. Today I want to discuss a topic of deep vein thrombosis. I'm sure all of you have heard a little bit about it. We have blood vessels which carry blood from the heart to various organ systems and back from the organ system to the heart through veins. There is a clinical entity called as deep vein thrombosis, which commonly affects the lower limbs or the legs. Patients who have pain, swelling of a leg, sometimes after trauma, sometimes after surgery, sometimes after hospitalization or prolonged immobilization, and very rarely after a long flight, could have a condition called as deep vein thrombosis affecting the veins. Typically, patients have pain, swelling, and difficulty in walking. Patients who have these symptoms should see a doctor as early as possible. The diagnosis of deep vein thrombosis is very easy. We do a non-invasive test called as Doppler ultrasound of the affected limb, which will confirm the diagnosis of deep vein thrombosis. Depending on the clinical scenario, age of the patient, and whether the thrombosis was provoked or unprovoked, we also do host of other tests to find out whether such an individual is at a higher risk of developing this thrombotic event repeatedly. It is important to diagnose deep vein thrombosis in the lower limb sooner because if left untreated, the clot can move to more vital organ like lungs called as pulmonary thromboembolism. The treatment of deep vein thrombosis depends on the site of thrombosis, depends on the severity of symptoms, and also depends on the effect that the thrombus has on the individual. Largely, most individuals are treated with medicines called as blood thinners or anticoagulants, which are extremely useful in preventing the clot from extending, in preventing pulmonary thromboembolism, which is moving of the clot from the limbs to the lungs. It is very important to diagnose this condition early and treat it well so that patients do not suffer long-term consequences of venous insufficiency. I must repeat, those individuals who have these suspicious symptoms should get to a doctor, do that non-invasive test called as venous Doppler to confirm the diagnosis of deep vein thrombosis, and treatment must be started as early as possible. Thank you.